Nice. Good. Good. Excellent. And hold.
I do.
Yeah, see,
Wow.
much better.
Yeah.
Excellent. Towers on. That's
Big
good.
difference.
Yes. Okay, good. All set. That's cool. Okay, so we have runner gets pain down the leg, low back pain, has a disc involvement, but we're finding that she may be a category 2. But so we're going to do a couple little checks here. Let's go ahead and raise your feet off the ground, or off the table about 6 inches. And relax there. Go ahead and raise it again. Okay, that's much harder. Much harder. Okay. So it's a right short leg. Let's go ahead and make a light grip and hold. Definitely there. Turn this way. Relax the arm. And hold. Definitely there too. Okay, just relax. Okay, so we're gonna block category 2 right now. Come right over here. Go ahead and bring your arm up this way. Straighten that leg. You're gonna kind of roll away. Right there. Come back this way. Straighten that leg. Come up this way. Bring this right there. Good. Feel a little lumpy?
Yeah, this is exactly where.
Exactly where you're having problems, huh? Okay, let's tighten it up. Now I'm gonna have you bend your knees, feet together. Squeeze your knees together, squeeze, and push out against me. Good, and squeeze, and push out. Good, and this might be a little tender. That's psoas. This light grip, turn it this way a little bit, and hold. That's better, just relax that. And hold, much better. I'm going to pull this out.
Okay.
Good. So the pelvis is much stronger right now, so let's have you go ahead and go under your stomach.
Okay.
Have to clear out some of this here. Excellent. Good. Nice. And she has this big pull coming forward here. Feel that? Yeah, lie on your back.
Yep.
And first I'm gonna get this here. Good. Nice. Good. Excellent. Now let's test this again, okay? Bring this foot up and out and hold. Feel the difference there?
Wow. Yeah.
Yeah, big difference. Hold.
I do.
Yeah, see?
Wow.
Much better.
Yeah.
Excellent. Towers on. That's
Big
good.
difference.
Yes. Okay, good. All set. Let's come on now.